Hi, Jessica Dufault, orthopedic and pelvic health physical therapist here in Madison, Wisconsin. And I'd like to talk to you today about 4 tips for bladder health, especially for those of you who may be experiencing urinary frequency and urinary urgency. All right, so tip number 1 is making sure you're staying hydrated. And this sounds really simple. However, in our clinic, we see a lot of women who struggle to get enough fluids through the day. So thinking about half your body weight in fluid ounces, plus 8 ounces if you're breastfeeding, plus an additional 8 ounces per hour of sweat during exercise. So that means that a 100-pound person, their baseline water intake should be about 50 ounces. And then we add 8 ounces, let's say if you're breastfeeding. Okay. The other tip is that that needs to be fairly evenly dispersed over waking hours, so that we shouldn't have 3 hours of no fluid intake and then all of a sudden we're gulping down 20 ounces of fluid. Okay, so if you're trying to change urinary frequency and urinary urgency, this is a really good tip to keep your bladder well hydrated and your urine less concentrated throughout the day. Now, that advice may vary depending on your specific needs, so making sure you talk with your naturopathic physician or your medical doctor or a nutritionist, somebody who can give you additional advice based on specific needs for your body or your other health conditions. Tip number 2. Let's please stop urinating just in case, all right? This is a huge contributing factor to urinary frequency. So that just because you're leaving the house doesn't mean you should empty your bladder unless you're having the urge to empty your bladder because your bladder's full. So that over a period of time of reinforcing this just in case urinating really causes a change in a neural pathway that then causes your bladder muscle to want to contract at lower capacity. And so this is what we see with men and women who need to urinate every 20 minutes, every 30 minutes. So making sure you're not urinating just in case, and also please stop reinforcing this with small children. So once children are fairly well potty trained, it's really important that we trust when they say, I don't have to go, and it may be inconvenient because the second you leave the house and get to the grocery store, they may change their mind. However, that's really relying upon their own body to tell them, yes, it's time to eliminate my bladder because my bladder's full. All right. So tip number 3 is to please stop hovering over public toilets. When we stand in a semi-squatted position like this, we have a contracted pelvic floor. And so the cue for the bladder to eliminate is actually a pelvic floor that releases. So we have to push out against pelvic floor pressure in that position. Now, I'm not against squatting in general. If you can come down into a deep full squat like this, that's great because that's a really open and released pelvic floor. So this is great if you're out for a hike or out camping for a weekend. Squatting down deep into this position is a great release for the pelvic floor. And lastly, tip number 4, if you're having urinary urgency, which means that you lose urine on the way to the bathroom, or if you hear running water, or if you're putting your key in your front door and you have that urgency, if I don't get to the toilet now, I'm going to lose this urine, what I would have you do is stop and work on a lot of deep breaths, slow, deep breaths. And what that does is calms the bladder muscle down. Now, if that doesn't work, I would suggest doing 5 quick pelvic floor contractions. We know that when the pelvic floor is contracting, the bladder muscle actually has to stop contracting. So 5 quick squeezes can help calm that urgency down. So those are 4 tips that everybody can start incorporating to improve their bladder health. Thank you.